My name is Claire Champion. I am now a nurse practitioner at Texas Children's Hospital, working with Elise Whalen in the pulmonary hypertension group there. Previously, I was an ICU nurse in the PICU for 5 years and was on the floor that kind of focuses on the pulmonary hypertension kids that are there for a long time. And so I had a lot of bedside experience with this population. And when I graduated nurse practitioner school, I didn't really know what I wanted to do. So I just kind of hung out for a while. And then this job opening posted, and one of the ICU attendings, Dr. Charton, who's one of the PH doctors as well, came up and was like, "Are you going to apply?" And initially I was like, absolutely not. I don't want anything to do with that, because it's a very hard population to deal with. And I knew it was going to be a lot of education. And, it's so different being an ICU nurse and being a nurse practitioner. And so he was like, "I think you'd be great and we will get you through the program." And that's kind of what happened. And here I am. And it's really been a great opportunity and experience. And the education I have learned is, I can't even begin to say how much it has really been like life altering. We initially had a PICU that was not cohorted. And then Texas Children's built a new tower called Legacy Tower that was specifically designed for the new ICUs. And so what they did was, we have 3 different floors. We have the 9th, 10th, and 11th. And so they cohorted it so that when consulting groups would come in, they had all their patients in the same kind of area. And I was never scared of the pulmonary hypertension kids. It didn't bother me. And so I just kind of ended up on that cohort of the unit. And so I had a lot of experience and it worked out for me. I think from the bedside nursing perspective, you really just have to focus on getting a good relationship with the parents and getting them to trust you, because they're overwhelmed, they're exhausted, they're constantly there. Their kids sit in the ICU for months. And so really figuring out what the parents want for their child and how they want their child to be cared for is, I would say, the number one most important thing that you can do. And then it gives the parents kind of that ability to feel more comfortable, and they can start leaving the bedside, getting back to some of the other things that are important in their lives, their other children. And then you just kind of adapt to what the kid needs, because all of the PH kids, no one is the exact same. And so there's a difference between the idiopathics that come in, and they're usually not there for too long. They're usually kind of a 2-week max type of patient. And then you have the BPD babies that are there for months. And so you just kind of feel out what the parents and what the family is wanting and go from there. One of the things I think is cool about transitioning to the nurse practitioner job is that now I do get to see some of these kids as an outpatient, whereas when you are an ICU nurse, you don't see them ever leave. And so that part gets really hard, because it feels like these babies are just sitting here for months and months and not progressing. And so I think the flip side of switching to the provider role is, now I get to see, wow, eventually one day we will get there. And so it's nice now to go in as a nurse practitioner to some of these families that are in the ICU and talk about the positive outcomes of kids that, oh, 3 years ago, I had this patient who was in the same position as you, and now they're out and they're living their best life. And there's a positive end, because a lot of times in the ICU, everything is so negative and just drowning. And so I think that's one of the benefits of switching to this role, is seeing the fun side of outpatient world. You have to learn to kind of disassociate yourself from work and your real life, because when I first started as a PICU nurse, that was probably one of the hardest jobs I could pick straight out of graduating from just general nursing school. And it was very depressing. And there were times that I would drive home and you don't turn the radio on. You just sit there in silence and are like, wow, that was a very rough day. But then you learn to rely on your nursing friends and the people in that community, because they understand what you're going through. And so you can always vent, or you talk about anything else and they kind of get you through it. So I think one of the most important parts of being in this career is finding coworkers to have an outlet to kind of speak to. But then I think there's a lot of positives that you learn, and you get to see a lot of miracles as well. There's so many things about children, they're so resilient, and you get this diagnosis and think they're never going to get through it. And then I saw a kid that was on a PEEP of 24, and now he's on a PEEP of 12 and doing great. And so there's just a lot of cool things that you get to see that I've seen in my 7 years in the nursing profession, that they're just eye-opening to what children can go through and what they push through. It's a nice change to see them outpatient, because we see our kids about every 3 months. And so you actually get to know what's going on in their life outside of just their disease process. And so when you're in the ICU, it's more of, what are we doing today? What are we changing today? What happened overnight? And now outpatient world, it's, hey, my birthday was yesterday and the whole family went to Chuck E. Cheese, and we're going to, is it okay if we fly this summer and go to Disney World? And there's just a lot more positives that you get to see from the outpatient perspective, and a lot of just different social aspects that you don't think about when you're just in the hospital. And so that part has been amazing to see kids have normal lives as much as they can outside of their disease process. I have to admit, not all of it is great. Sometimes kids will come in and their walk test is worse or their echo is worse or they're, having cyanosis or whatever the reason is. And so it does get kind of tricky because you want everything to be so great every time you see them. And there are times that there's not. And do we need to admit you? We need to change your therapy. Things are getting a little bit worse. And so those conversations are really tricky. But at the end of the day, the most important part is having that strong relationship with the family where they can trust you and it all works out. And it's nice to have providers and nurse practitioners and the whole team, our social worker, our nurses, our dietitians, everyone kind of comes together for that family and we bend over backwards for them. And so that part has been really nice to see a whole team because when you're in the ICU, it's really the ICU team. You maybe see the consult teams every once in a while, but you don't see the whole outside picture and just the amount of conversation that goes on about each of our patients. I didn't know how many meetings I was going to have in this nurse practitioner role. And so it's really cool to see everything behind the scenes. Just be honest and be open on what your family is going through. Sometimes we get palliative care involved and the palliative care team will come back and say, this mom is really struggling with XYZ and it has nothing to do with the child. And so I think the best advice is to be open about all of the ongoing issues that are going on, because even if it's not about your kid with pulmonary hypertension, we can still help in whatever way that your family is needing because it's all or nothing type situation. And so I think that piece is really important for families to just know, our center really wants the best for everybody involved. My name is Claire Champion, and I'm aware that my patients are rare.